Right now, as you're watching this video, your arteries could be silently closing. No pain, no obvious symptoms. Just a gradual narrowing that's cutting off blood flow to your legs, feet, and eventually your heart and brain. The first place many people notice something wrong isn't in their chest, it's in their legs. By then, blockages may already be 70% closed, and the clock is ticking toward a potentially catastrophic event. What makes this especially dangerous? The warning signs are so easy to dismiss. Just getting older. Probably need to stretch more. Must have pulled a muscle. These common excuses could cost you your legs or your life. In this video, we're exposing the 5 critical warning signs in your legs that suggest your arteries are dangerously blocked. These aren't minor aches and pains. These are urgent distress signals that demand immediate attention. Let's start with the most commonly overlooked warning sign, one that 8 million Americans experience, but most misinterpret until it's too late. Pain when walking, that goes away with rest. You're strolling through the grocery store. Halfway down the aisle, a deep ache starts in your calves or thighs. The pain builds until you have to stop. After resting a minute, it vanishes completely until you start walking again. This isn't normal aging. It's not a pulled muscle. It's called intermittent claudication, and it happens when your leg arteries are so narrowed by plaque that they can't deliver enough blood to your muscles during activity. Think of it like a garden hose with a kink. When your muscles demand more blood during walking, the narrowed arteries can't supply it. Your muscles scream for oxygen, creating pain that won't quit until you stop moving and your oxygen demand drops. What makes this warning sign particularly deadly is how perfectly predictable it is. The same distance triggers pain. The same rest period relieves it. This consistent pattern is what distinguishes it from other leg problems and makes it a clear signal of peripheral artery disease, PAD. The numbers are alarming. People with this walking pain have a 3 to 5 times higher risk of heart attack and stroke. Why? Because if your leg arteries are blocked, your coronary and carotid arteries are likely clogged too. It's rarely isolated to one part of your body. More frightening still, without treatment, 30% of people with claudication will need an amputation within 5 years. The blockages worsen, blood flow decreases further, and tissue death becomes inevitable. If walking a specific distance consistently causes leg pain that disappears with rest, don't wait. This isn't something to monitor, it's something to address immediately before permanent damage occurs. One leg or foot colder than the other. Take off your socks right now and touch both feet. Are they the same temperature? They should be. When one foot or leg feels noticeably colder than the other, it's rarely a coincidence. It's often a sign that the arteries feeding that limb are critically narrowed, reducing blood flow and the warmth it brings. This temperature difference happens because blood carries heat. When less blood reaches one leg due to blockages, that leg becomes cooler than its well-perfused partner. It's physics, not aging. What makes this particularly concerning is that temperature differences typically appear when blockages have become severe, often exceeding 70% of the vessel diameter. At this point, you're in the danger zone for critical limb ischemia, where tissue survival is threatened. The temperature difference may be subtle at first. You might notice one foot always needs an extra sock, or one leg feels chilly against your sheets at night. As blockages worsen, the temperature disparity becomes more obvious and more dangerous. Studies show that this asymmetric coolness is one of the most reliable indicators of advanced PAD, yet it's among the most commonly dismissed. People attribute it to poor circulation without understanding that poor circulation isn't normal, it's a medical emergency waiting to happen. If you notice one leg or foot constantly feels colder than the other, don't just reach for warmer socks. Reach for the phone and call your doctor. This temperature difference might be your last warning before serious complications develop. Slow healing wounds on legs or feet. That small cut on your foot has been there for weeks. The scrape on your shin won't close. Maybe you've developed a persistent sore on your toe or heel that defies every home remedy you try. This isn't bad luck. It's catastrophic circulation. When arteries are severely blocked, they can't deliver the oxygen, nutrients, and immune cells needed for wound healing. What would heal in days for someone with healthy arteries can linger for weeks or months when blood flow is restricted. Here's what makes this warning sign particularly sinister. It often appears on the feet, where you might not notice it until infection sets in. By then, the situation has escalated from concerning to critical. The statistics are grim. Up to 40% of non-healing wounds on the lower extremities lead to some form of amputation. Once tissue has been oxygen-starved long enough for a wound to stall, the damage is often irreversible without immediate intervention. The location of these wounds isn't random. They typically develop at pressure points or areas with minimal tissue between skin and bone, toes, heels, ankle bones, and shins. These areas already have relatively less blood flow, so when arteries narrow, these regions suffer first. If you notice any wound on your legs or feet taking more than 2 to 3 weeks to show significant healing, don't wait for it to worsen. This isn't a cosmetic issue, it's a cardiovascular crisis unfolding in slow motion. Shiny, hairless skin. On legs. Look at your legs. Do they have a strange shine to them? Has the hair disappeared from your ankles, shins, or feet? This isn't an aging quirk or a grooming benefit. It's your skin sending an SOS about the blood supply beneath it. When arteries narrow significantly, your body makes desperate adaptations. The skin, starved for oxygen and nutrients, becomes thin and taut, developing an unnatural shine. Hair follicles, which require robust blood flow to function, simply shut down. The result is smooth, shiny, hairless skin, particularly below the knee. What makes this sign especially important is that it develops gradually. You won't wake up one morning with suddenly hairless legs. The change happens over months as your arteries narrow progressively. Many people don't notice until the transformation is dramatic. Research shows that this skin change is present in over 60% of patients with advanced peripheral artery disease. It's not just a cosmetic oddity. It's reliable evidence that your tissues are being systematically deprived of blood. The most alarming aspect: once these skin changes appear, you're often just months away from more serious complications like non-healing wounds or tissue death. Your body has exhausted its compensatory mechanisms and can no longer hide the crisis. If you notice unusual shininess or hair loss on your lower legs, particularly if it's asymmetric or has developed over time, don't dismiss it as a normal part of aging. It's a visible manifestation of an invisible threat that's closing in on your limb survival. Pain in your feet at night that improves when dangling your legs. You're trying to sleep, but a deep aching pain in your feet won't let you. It's not pins and needles. It's not muscle cramps. It's a profound discomfort that seems to come from the bones themselves. Then you discover something strange. If you hang your feet over the edge of the bed, the pain improves. If you get up and take a few steps, it gets even better. This counterintuitive symptom has a name: rest pain, and it's one of the most serious warning signs of critical limb ischemia, the advanced stage of peripheral artery disease, where tissues are literally starving for blood. Here's why it happens. When you lie flat, gravity is no longer helping push blood to your feet. Your critically narrowed arteries can't deliver enough blood on their own. Your oxygen-starved tissues scream in pain. But when you dangle your legs, gravity helps pull blood down into your feet. Standing does this even more effectively. The pain subsides not because you've stretched anything out, but because you've temporarily improved blood flow through the sheer force of gravity. This warning sign is particularly ominous because it typically appears only when blockages have become severe, often exceeding 90% of the vessel diameter. At this stage, you're at imminent risk of tissue death and gangrene. What makes rest pain especially dangerous is its timing. It often wakes people from sleep between 2 and 4 a.m., when blood pressure naturally drops to its lowest point. This further reduces blood flow through already critically narrowed arteries, creating the perfect storm for tissue damage. If you find yourself dangling your feet off the bed to relieve night pain, don't wait until morning to call for help. This symptom indicates you're in the final window before permanent damage occurs.